I have Alex here, and we're going to do a knee hyperextension tape job. So he's dealing with knee hyperextension pain in his right leg. So we're gonna work to deal with that. So what sport do you play?
I play basketball.
Basketball? What position?
Power forward.
Power forward. I can tell by your size. So the first thing I'm going to do is just I'm just going to get you to pull your shorts up a bit on that side. Just on the one side, that's fine. And I'm just going to check for decap BTLS, just making sure that we have no cuts, anything like that on his leg. Just again, lots of marker. Have you been taped before?
I have.
Yeah, or you're not allergic to tape or the spray,
Not at all.
nothing like that? Okay,
No.
great. So now I'm just going to check PMS. So I'm just going to check cap refill, which is good. Can you wiggle your toes for me?
Yep.
You can feel this?
I can.
Okay, great. So now we're going to start. We would apply a spray right now, but I don't have it. I'm just going to get you to go into a lunge position with that leg forward. Awesome. Facing away. Just pull your shorts up just a little bit more. So I'm just going to apply an anchor on the top, just up on his quad. Just like that. So we have one anchor there. If your athlete has like really big legs, you could use 3" again on their calf, but Alex here will be fine with using the 2". So we're just going to kind of come just below the tibial tuberosity as our landmark. And again, we're just going to come around a little bit with that 2". Just applying a nice spot to anchor. Now, I've already pre-made a fan for him, but all it is just 3 strips of tape over top of each other on one side. You could do 4 or 5 if he's a bigger athlete, but just basketball, it's not. He's not likely to need that much. And then 1 piece of tape on the other side. So what I'm going to get him to do first is I'm just going to figure out what his range of pain is. So I'm just going to get you to come back into extension and just tell me when that pain starts.
Right here.
Right there? Okay, so what we're going to do is we're just going to move you a bit forward, just like that. Just a couple degrees out of that painful range. And now we're going to take our fan and we're going to apply it. We're going to apply it like so. The other thing we can do is we can put a heel and lace pad, which I don't know where mine went. I had a heel and lace pad right here. And you can just apply that in the back, in that popliteal fossa, so that when this comes in, it's not going to rub. And now we're just going to close that in, re-anchoring, making sure that the tape stays. So we can come back over like this. And again, bring the 2" down to the bottom. I'm going to come around this an extra time because I'm going to pull this up and catch it here just to make sure that this side holds. Again, not a lot of tension. It's just to help hold on the tape job. So you said basketball, right?
Correct.
Do you happen to wear like a compression sleeve on your leg?
I do.
So that'll cover over top of that?
Yep.
No problem? Okay, great. So I'm just going to recheck PMS now that I've applied this around his foot. So we're just going to check cap refill, which is good. You can wiggle your toes, awesome. You can feel this?
Okay.
Great. So now we're just going to go through some functional testing just to make sure that this is stopping that painful range that you can play in, okay?
Okay.
So basketball, so can I just get you to do some jumping first?
Yep.
How's that feel?
Feels good.
Good? And now just like a little bit of forward back. Come towards me, go back. Great. Is that stopping that range?
Yeah.
Yeah? Okay, awesome.